So I know the dancing nurses pissed a lot of people off. Okay. And I know you left a couple of comments, so I'm going to address two of them. This one and your other one about nurses should face tribunals. Okay. So that's going a bit far. Because what you're dealing with, first of all, what people don't understand is when COVID hit, that's when hospitals started using travel nursing on a mass scale. Mass. So a travel nurse is usually at an assignment 13 weeks, unless they extend. If most of the staff on an ICU unit is travel nurses, and there's many, your biggest universities, that majority of the units, like ER, ICU, that's travel nurses. So it's easy to, they come in and out. They may not see the pattern that the remdesivir protocol isn't exactly having good outcomes. So the nurses that have spoken up about it, they were permanent staff. So they saw that, no, we're not, why do we keep using this protocol? So take that into consideration, because if a nurse is coming in for 13 weeks, they may not see that pattern because they're gone to their next assignment after 13 weeks. You see what I'm saying here? The other thing is that, look, there has to be some direction to follow, especially if you're in healthcare. It's just that, you're not going to get most of healthcare to see most of what I'm saying. They can't even see how they don't critically think. They only critically think within the boundaries of what CDC, the New England Journal of Medicine, or the Lancet say. That's the extent of their critical thinking will go. If you try to tell them that you don't trust those journals, or most of them, because for obvious reasons, let's take mental health, that's my area, there hasn't shown to be any improvement, most especially in the area of schizophrenia. So here's an example of what I mean. I was training a nurse the other night. She's a new nurse, but she worked as a social worker before, so she knows the lay of the land with mental health. And she's in a DM program, and she was doing this paper on this article about, I guess the experts of mental health think that it would be a good idea to use virtual reality on schizophrenia patients. That is the worst thing to ever do. It's cruel, in my opinion. I don't need to do a bunch of research to know that. And I was trying to explain this to her. I said, the needle has not moved with schizophrenia since it first came on the scene. What is science doing? Why do we still have schizophrenia? It actually should be gone if our science was so expert. But instead, our science shows how unethical they are, because even though I think virtual reality, because I had suggested it to Northwestern, or my leadership at Northwestern back in 2018, that virtual reality would be good for anxiety and patients and people with depression, because you're fully immersed and can do a meditation, and it has great benefits for people that struggle with those disorders. But I remember saying it should never be used on a schizophrenia patient, because they're already struggling with reality, and then you're going to put them in virtual reality. Like, come on, hello. And the experts, yeah, but they wrote this long page after page after page of why virtual reality should be used on schizophrenia patients. No, it's cruel. It's the worst thing to do to somebody that has trouble being oriented to reality. But they want to utilize it so that they can help schizophrenia patients recognize more social cues. So this is the kind of thing I mean. But that most of the healthcare system, they're going to look at me like, you don't have all their education. They won't even consider what I'm saying, even though what I'm saying is totally based on common sense. There is not, we should not still have schizophrenia. Not if the science was really trying to do something about it. And most definitely we should have more answers to it. We don't have any more. We just have more meds that come out that pharma wants to use that doesn't seem to help, or if it does initially, it's just for a short time. So the experts aren't expert because they don't show that there's positive outcomes. They'll tell you they have positive outcomes. That doesn't, or if they have some here and there, but there's not enough to say that they know what the hell they're talking about. But then I don't usually tell this to people in healthcare, because I don't think they'd even consider it, because they're already like a deer in the headlights when I try to tell them, don't you see how the experts, they haven't moved the needle at all with schizophrenia or many other disorders. Just like with viruses, we have more mental health disorders as time goes on, and we have less cures, and we have no, we just really have no positive outcomes except for here and there. We just, this is a cycle, continuing cycle. So that alone, for somebody who truly uses critical thinking, that should be like the red flag that goes off that says, yeah, there is something wrong with this. But it doesn't for most nurses or people in healthcare, because they've been educated to only stay in that box. So I that's why I've said for years now, I don't think most of the higher educated, they will be able to snap outside the box, because they will always see the Lancet. No matter if they, just look at the track record in mental health, and you could see the experts don't know what they're doing. But more, I think they just don't want to really give all the information, because there's been people controlling all the evidence that comes out. I'm sure that there's answers to schizophrenia. Maybe it just doesn't serve pharma for the truth to come out. Just my opinion. But if any honest person on the face of it, even somebody in healthcare stepped outside the box and said, okay, if I want to truly be a critical thinker, it means I shouldn't just listen to the Lancet or read the Lancet. I shouldn't just believe the CDC, but I should look at all of these other things. The thing is most healthcare workers aren't going to do that, because there's a benefit for the corporate world and the powers that be to keep you short-staffed. But besides it being, it's less money they have to pay. It's because it stresses you out. I've seen for years how it's like they want to stress nurses out. They want to cut you so thin you're pulling your hair out. They want you so busy either getting your master's, your bachelor's, your doctoral, your specialty certificate, whatever it is, they want you to focus on that so you won't do any thinking at the bedside, so that you won't just do some thinking for yourself. So nurses have become accustomed to this. And because in school it was taught that these are the experts, and it is just this belief that when they have all these letters after their name, or if they're a doctor or a scientist, or if they're in this journal, it means that they know the truth. No, they don't. They don't. And that should be obvious when you just step outside the box and look at it. But I've tried to get nurses, like even this nurse I was trying to tell about this schizophrenia paper. I said, look, I don't trust many of these journals. They haven't moved the needle with schizophrenia at all. And I said, here's the reason why virtual reality would be the worst thing. She just looked at me like a deer in the headlights. Or sometimes what nurses will do is, it's always the same expression. It's just sort of a deer in the headlights. Or they'll act like that they know what you're talking about, and you can see that they have no comprehension of it. So it's kind of, it's cruel in a way, because to say, oh, they should just be at tribunals. No, that people have been educated by this system and manipulated into this system, and sadly they can't snap themselves out of it, which is why I said that this is why healthcare pushed higher education for nurses, because they knew they could bound people more and more into this cement thinking that says, I only stay within this box, which means you can't be an expert when you just stay in a box like a trained dog. You to be a true expert and a common sense thinker and a critical thinker, you have to step outside the box and look at all of the landscape. So just take that into consideration.